Hi, this is Elliot Fishman, and welcome to the January 2018 CTisus quiz. OMG, January 2018. When did that happen? Anyway. Okay, we have 10 terrific cases for you. We wish everyone success on our 10 cases this month and every single month of the coming year. So let's get started. What's the most likely diagnosis in the 60-year-old female? And if you look at the images, I'm giving you an axial and then a 3D volume rendering. You see a large infiltrating tumor that's pushing the right kidney forward and to the left. And when you look at it, it's low attenuation, and some of it looks like fat. It's kind of a model attenuation. Interestingly, on the 3D image, that displacement of the liver, that modeled attenuation, the displacement of bowel from right to left is also seen. So what's the best answer? Well, obviously it's a female. Ovarian cancer is a consideration, but there we see all sorts of tumors. We see implants on the omentum, the mesentery, but usually not this displacement, and the fat density would be unusual. Lymphoma can involve the perirenal space, but not this kind of mass, and again, not the fat density. This is not a retroperitoneal bleed. This would be high density. This is a retroperitoneal liposarcoma. The most common retroperitoneal tumor are liposarcomas. They can be very large, displaced structures without obstructing. It always interests me, these large liposarcomas displace the kidney, displace the bowel, but don't cause obstruction. And although they seem at times to look encapsulated, they're not. Surgery will be done just to debulk the tumor, and then chemotherapy will typically follow. In this teenager, what's the most likely diagnosis? It's an impressive case. What you're looking at is a large chest wall mass. And if you look carefully, you can see that it's involving the patient's third rib on the right. So you could say, well, maybe it's a chest wall mass that's invading rib. Could it be a mesothelioma? Wrong age. Could it be a sarcoma? Okay. What kind of sarcoma? Well, the classic one involving bone and chest wall in a child is not lung cancer. And it's not lymphoma, which can involve the chest wall. But the masses are more solid, and you would expect to see nodes, which you don't see in the 3D images. Osteosarcoma is a thought, an unusual bone, flat bone. It's not that common, but you don't see any matrix. The best diagnosis is a Ewing sarcoma, and indeed, this was a Ewing sarcoma, just a classic example. In the 6-month-old male, what is the anterior mediastinal mass due to, or anterior mediastinal structure? Okay, you might say, well, could it be teratoma? Could it be lymphoma? Could it be hyperplasia of the thymus? Well, the thing to remember is children, particularly under 5, have very large thymuses. Homogeneous enhancement, this is not a mass. This is not hyperplasia. This is your basic normal thymus. This patient, middle-aged female with abdominal pain, what's the best diagnosis? Now, what you see here is a large mass infiltrating the abdomen. Interestingly, there's some bowel displacement, but there's no obstruction. Could this be ovarian cancer? I'll start from the bottom. I guess it could be, but usually you don't see that large a mass so high up, but you can. I guess maybe theoretically I can put that in there. A sarcoma, retroperitoneal, possibly. Lymphoma, solid mass, I guess could be. Necrotic, particularly treated, could be. It's a tough case. This was actually a GIST tumor, which arose from small bowel. Remember we spoke about GIST tumors. They're vascular when they're small. The larger ones typically aren't vascular, but usually you see them as being exophytic. 70% are off the stomach, 20% are small bowel. But in this case, it's hard to tell where the mass originates, but this was a GIST tumor. So I'll give you a 50% credit, whatever you put down. This patient is post-Whipples procedure. What's the best diagnosis? What you see mainly is the low density, that large infarct in the patient's left lobe of the liver. There are some air bubbles, and there are several other infarcts present. And this is the classic example of an infarct. Yes, the infarct can become infected and be an abscess, and you see some air bubbles, which are in some of the biliary radicals. Focal fat can occur wedge shape, but this is too low density, and you don't see the vessels going through it. It's obviously not tumor recurrence. This is a liver infarct. Hepatic artery injury can do this. It's one of the complications of Whipples procedures. This case, what's the most likely diagnosis? So let's describe the case. Large cystic mass, head of the pancreas, multiple septations, pushing on the portal vein but not obstructing it. Now, SPEN tumors usually aren't in 55-year-olds, and they usually, more than half, will have calcification. Mucinous cystic neoplasms, the age is good, but that's usually the body and don't have septations. Typically, it's usually just a cystic lesion. Neuroendocrine tumors can be vascular, typically, but they can be cystic neuroendocrine tumors, but they typically have rim-like enhancement, and typically not as many septations. This is a serous cystadenoma. I know sometimes serous cystadenomas look more aggressive. Here you see some compression of the portal vein, a little bit of scalloping, and it's important to recognize that that indeed can occur. It's important to recognize that serous cystadenomas can cause pancreatic duct obstruction and at times dilated common duct, but serous cystadenomas are a tumor of many, many shapes. This is a great case. What's the best diagnosis? Again, a cystic lesion, but now you see calcifications. SPEN tumor, I guess it could be. SPEN tumors are usually females, but usually in their teens, early 20s. MCNs don't calcify, they're in the body or tail. Neuroendocrine tumors can be large, they can have calcifications. And serous cystadenomas. This lesion displaced the vessels. Unfortunately, I didn't show you all the images, but there was no invasion. Things were stretched but not invaded. And this was a serous cystadenoma. Now, the thing about serous cystadenomas, they commonly calcify. Often have punctate calcification centrally, but can have scattered calcifications. This is a tricky case. And if it was 20 years old, I would have given you SPEN. Neuroendocrine tumor, calcifications are denser. They're usually more vascular. I'm not going to give you any points for there. So I'm going to give you all the points for a serous cystadenoma. But again, a tough diagnosis. What's the most likely diagnosis in the 60-ish-year-old male? This is kind of an easy case. You see extensive pneumatosis of the small bowel. The small bowel has poor enhancement. This is not an ileus, and it's not obstruction, and it's not benign. This is ischemic bowel. The vessels are small. The bowel isn't enhancing very well. All the things you think about, in addition to very, very extensive air in the bowel wall, classic ischemic bowel. This patient unfortunately passed away. The most likely diagnosis in the 55-year-old female is, the thing is, you see the mass in the body of the pancreas. What you notice best is that it's fat. Little discussion, this is lipoma of the pancreas. You don't get liposarcomas. Maybe if you did, it would be invasion from outside in. But this is a pancreatic mass proper. You see the coronal views. It's all fat. It's a benign lipoma. Lipomas cause no problems. They don't bleed. They don't go and become liposarcomas. You see the answer. You can leave this lesion alone. This patient developed severe chest pain while eating. What's the best diagnosis? Well, I don't see much of the aorta, but I don't see a dissection. I don't see the coronaries, but I don't see a big infarct, but I wouldn't be nasty enough to try to trick you like that. What you notice is the esophagus is dilated and there's fluid and low density, almost looks like fat in the esophagus. Could this be achalasia? I guess that's a possibility. But the patient had no history of achalasia, but it could be. This patient had eaten steak and ate a big piece of steak and swallowed it, and now it's obstructed. And so some patients will have obstruction, develop obstruction. They get esophagitis. The piece of meat can't go anywhere. There's inflammation, and it needs to be removed endoscopically in many cases. So just a beautiful example. This patient had a steak, and what you're looking at is a steak in the esophagus causing obstruction and dilatation. So that's my 10 cases. I think they were terrific cases, if I have to say so myself. It's a great start for 2018. which hopefully will be a great year for all of us and for all of you. And with that, see you next time.